First, as Don said, I wanted to thank the American Liver Foundation for allowing me to speak. I'd be talking more about some of the details and some of the treatments and some other things about my cancer. About just over 2 years ago, I went in for a routine blood test, and from that blood test, they found some enzymes that were out of whack. And at ultrasound, and they found 9 tumors in my liver. My left lobe of my liver was totally gone. It was just one giant tumor. And in my right lobe, I had 8 tumors. So basically, it's inoperable, incurable, and I don't meet the criteria for a transplant. So I'm very jealous, Don, that you had a transplant. But I look at it that cancer does not define me. I just happen to be a person that has cancer. I live my life just like I would if I didn't have cancer. My doctors couldn't find a cause for it because I don't have hepatitis, I don't have cirrhosis. I just have the cancer, and no one knows why. So when you have cancer, you get a lot of blood tests. So if any fear of needles, make sure you get over it because you're going to get stuck a lot. And I mean a real lot. I already have scar tissue from some of my blood work. When I get my results, the first thing I look at is my AFP, or the tumor marker result. If it's going up, I know my cancer is getting worse. If it's going down, it's getting better. When I was first diagnosed, I was at 60,000, which is basically off the chart for AFP. And I got down to a low of 72 during one of my treatments, and I felt really good at that point. So some of the treatments I've had is lenvatinib, radioembolization, or Y90, immunotherapy. I was in a clinical trial for about 14 months, which was great because it worked out better than any of the other FDA-approved drugs. And it was a phase 1 clinical trial. And that's when I got my AFP down to 72. After being in the trial for so long, my numbers started to go up, my AFP numbers. So I was taken out of the trial, which was a very sad day for me because it'd been working so well for almost 14 months. So I took pictures, and we found out it was just one tumor that was causing my AFP to go up. And to make matters worse, that tumor was growing inside of my portal vein, and it was starting to impede the blood flow through the portal vein, which brings oxygen and nutrients to your liver. So if that portal vein got blocked, that would mean probably a much shorter life for myself. So in order to combat that, we decided on using photon therapy. So I had to go every single day for 11 days to get a photon therapy treatment, which was all kinds of fun. And the biggest thing is I had this treatment in mid-September. I have to wait till November to find out if it worked or not. Because when you bombard your tumor with radiation, it takes a while for it to work. First it gets inflamed, then it calms down, and then hopefully eventually it kills it. So I'll know in 19 days whether it worked or not. I'll get pictures the day before, and then we'll take a look at it and see if it worked. During the same time, I started back with immunotherapy. And these were the 2 drugs that were mentioned yesterday, in combination. I'll use the brand names, and they are Tecentriq and Avastin. And again, I believe this was mentioned yesterday in the conference. And so far, they seem to be working pretty well. I had a treatment yesterday, and 3 weeks from before yesterday, in the last 3 weeks, my AFP has gone from 10,400 to 1,080. So it's down over 9,000 points in 3 weeks, which is, for me, I'm very excited about that. And I hope everyone would be excited about that. I'd acquired a lot of knowledge through the last 2 years, 2+ years of having liver cancer. So just over a year ago, I decided to share my knowledge, and I started making a series of TikTok videos for people that were newly diagnosed with liver cancer. I wanted to know what they're in for, how their lives could change, the good, the bad, and the ugly, everything about it. And one of my favorite TikTok videos is, it's called "Don't Leave Your Spouse in the Dark." I'm terminal, and sometime I'm gonna die. And I pay all the bills, I do the taxes, anything financial I do in the house. So what I did is I created a very detailed process on how to pay the bills, when to pay them, which accounts they come out of. I also created a detailed process to pay the taxes, and I created a budget going out 4 years so my wife could see long term if we're going to be in any kind of financial trouble or not, and she could take steps to correct that problem. My biggest pet peeve, and I think, Don, you could relate to this, is waiting. You go to the doctor's office, you wait 3 hours for your appointment that was supposed to be 2 hours ago. You wait for test results, like this radiation treatments I had. I had to wait 7-8 weeks to get the results. And even when I switched treatments, it's called a washout period. So I have to wait till one medicine goes out of my body so they can start the new medicine. And during those 3 weeks, I have a very aggressive cancer. So it starts growing very quickly before I start that new treatment. And so just some recommendations from me as a terminal patient is, when diagnosed with cancer, I recommend the following. Be your own advocate. Do the research on your cancer. If the doctor says something you don't understand, don't stop there. Ask questions until you get the answer you want, that you understand. Sometimes doctors will, not all doctors, but sometimes doctors will just go through something very quickly without you really knowing what they're talking about. And I'm someone who wants to know what a doctor is talking about. So I'll stop them and say, we're not leaving this office until I understand what exactly is happening and what you're talking about, and how it's going to affect my body, and so forth. I said this earlier, as best as you can, live your life as normal as possible. Don't let cancer control your life. Again, I have cancer. I live my life as normal. I work out. I try to do volunteer work in various types of environments. And I don't let it control me. I control the cancer. Another very important thing is to have a great support system in place. Family, spouse, friends. And as you know, cancer can be very stressful, especially when you're feeling very sick more from the treatments than the cancer itself. And at that point, it's really important to have someone to talk to. And many hospitals will provide people in the social work to talk to you. Another important thing, as talked about earlier, is ask about clinical trials. Some work, some may not work, but for me, it gave me 14 months of life, of additional life. So for me, it worked pretty well. And lastly, if you're terminal like myself, make sure that your wishes are known and are documented in your advance directives before you die. Get a will, make sure everything is in that will, do your advance directives, talk to your spouse if you're married, and really be on the same page as far as what you want done after you pass away. That's pretty much it. I want to thank you all for listening. And if there are any questions, I'm happy to answer them. My TikTok is Bruce Bauer, and I have about 12,000 followers and about 50 or so videos. And it's been like therapy for me. My followers give me encouragement, and they've been great. So anything I can answer and help with, I'm happy to do so.